Okay, my name is Tanya, and I'm going to give you a brief overview of chapter 19 and chapter 20. Chapter 19, we're going to go over first, which is the lymphatic system. So, the lymphatic system has three main components. Essentially, those are the lymphatic vessels or the lymphatics, lymph, which is fluid in the vessels, and lymph nodes. Those cleanse the lymph. Lymphoid organs and tissues provide structural basis of immune system by housing phagocyte cells and lymphocytes. Important structures to know with the lymphocyte or the lymphatic system, which are interesting, includes the spleen, thymus, tonsils, lymph nodes, and other lymphoid tissues. So what is a lymphatic system? What it does is it returns interstitial fluid and leads plasma proteins back to the blood. How does it do that? It uses lymphatic vessels, which is an elaborate network of drainage vessels. It actually circulates 3 liters of interstitial fluid per day. That is a lot of fluid. Once interstitial fluid enters lymphatics, it's called lymph. Distribution and structure of lymphatic vessels. So the vessels offer a one-way system, which ensures the lymph only flows towards the heart. So it never goes in an opposite direction. Lymphatic capillaries, blind-ended vessels that weave between tissue cells and blood capillaries. Those are absent from bones, teeth, and bone marrow. So what are lymphatic capillaries? They're similar to our blood capillaries, but what they mean is they're more permeable. Fluid's able to access them easier. They can take larger molecules and particles that blood cannot carry. So they can take larger molecules. Example, they can take proteins, cell debris, pathogens, and cancer cells. So this is just showing you lymphatic capillaries. All right. So how is lymph delivered? Lymph is delivered from trunks into 1 or 2 large lymphatic ducts. There's the right lymphatic duct, which drains from the right upper arm and right side of the head in the thorax. The thoracic duct drains the rest of the body. And about half of individuals starts out as an enlarged sac. The cisterna chyli. So here are some conditions that can be affected by a misproper lymphatic system. Lymphangitis, just itis, is an inflammation. So essentially this is an infiltration of that lymph. So lymphatic vessels, they appear to be painful, red. You can actually see lines under the skin. They're usually caused by inflammation of larger lymphatic vessels that contain vasovasorum. Vasovasorum become congested with blood. Larger lymphatics like blood vessels receive their nutrients from branching vasovasorum. Lymph transport. So the lymph system is a low pressure system like the venous system. Lymph is propelled by the same mechanics. So it's propelled by the milking action of the skeletal muscle, pressure changes in the thorax during breathing, valves to prevent backflow, pulsations of nearby arteries, contractions of smooth muscles. Another condition is lymphedema. That's severe localized edema. Typically, it's in the bilateral low extremities, caused by anything that prevents normal return of lymph to blood. So something that could cause it would be a tumor blocking lymphatics or removal of lymphatics during cancer surgery. Usually these patients actually go to a lymphedema clinics and there's lymphedema wraps to help keep that interstitial fluid into the vessels. So lymphoid cells. So a lymphocyte is a big part of a lymphoid cell, and that's a cell of the adaptive immune system, mature into 1 or 2 types. You got your T cells and you got your B cells. So T cells manage immune response, and some also attack and destroy infected cells. The B cells produce plasma cells, which secrete antibodies. Antibodies mark antigens for destruction. So other lymphatic immune cells, macrophages, dendritic cells, reticular cells in the stroma. Lymphoid tissue houses and provides proliferation sites for lymphocytes, largely composed of reticular connective tissue, a type of loose connective tissue. lymphoid organs. So diffuse lymphoid tissue, loose arrangement of lymphoid cells and some reticular fibers found in virtually every body organ. This just shows you the lymphoid organs. Primary lymphoid organs, we talked about those two in the secondary. So primary would be those thymus and the red bone marrow. Your secondary would be your lymph nodes, tonsils, spleen, Peyer's patches, appendix. So lymph nodes, we always have our doctor feel our lymph nodes, right? So essentially, these are hundreds of nodes throughout the body. We just know we have them, the doctors typically feel on our throat. So what do lymph nodes do? They cleanse the lymph. They act as filters. Macrophages remove and destroy microorganisms and debris that enter the lymph. Essentially, macrophages prevent unwanted substances from being delivered to the blood. They're the garbage disposal. So immune system activations offer a place for lymphocytes to become activated and mount an attack against antigens. Structure of a lymph node, they vary in shape and size, but mostly they're small and less than an inch. They're surrounded by an external fibrous capsule. They extend inward as trabeculae that divide node into compartments. Typically, there's two historically distinct regions of the node, a cortex and the medulla. And it's going to go into depth about the cortex and the medulla, but I'm going to continue on. Buboes. So these are inflamed, swollen, tender lymph nodes that happen because of an overwhelmed system that's trying to destroy. These are what we know as our swollen glands that the doctor fills. Sometimes they can be pus-filled, but the interesting fact here is that the bubonic plague was named after them. The spleen. So the spleen is a blood-rich organ about the size of a fist located on the left side of the abdominal cavity, just below the stomach. So severed by a splenic artery and vein, which enter and exit at the helium, the functions essentially, it cleanses blood of aged blood cells and platelets. There's the spleen. The spleen helps prevent or helps develop white and red. Oh, I lost it. Oh. Well, I lost it. All right, there we go. White pulp and red pulp. White pulp, that's where the site of immune functions occur. Red pulp, that's where old blood cells and bloodborne pathogens are destroyed. So what happens when you get the spleen removed? It's splenectomy. That usually happens because the spleen ruptures. MALT, mucosa-associated lymphoid tissue. Those are lymphoid tissues and mucous membranes throughout the body. Protects from pathogens trying to enter the body. They're found in the mucosa of the respiratory tract. Also found in tonsils, Peyer's patches, and the appendix. So typically the tonsils are the simplest lymphoid organ. Peyer's patches, that's a cluster of lymphoid follicles and wall of distal portion of small intestines, also called aggregated lymphoid nodules. Then we have the appendix. It's an offshoot of the first part of the large intestine. It contains a large number of lymphoid follicles. And there's the thymus, bilboid lymphoid organ found in the interior neck. Essentially, that helps where T cells mature, and it's the most active and largest in size during childhood. That essentially is the lymphatic system. Now we're going to go to the immune system. Okay. All right, so the immune system. So our immune system provides resistance to disease. Essentially, it's there to protect us from any virus, bacterial, any bug that's going around. It's made up of two intrinsic systems, the innate non-specific defense system, which is our first and second lines of defense. Think of like a football team. These are our guys that are first and then second in. our first line, second lines. So the first line of defense is an external body membrane, so our skin, our mucosa. The second line of defense is antimicrobial proteins, phagocytes, and other cells. Then we also have the adaptive or the specific defense system. This is our third line of defense. This attacks particular foreign substances, but this, however, takes longer to react than the innate. So our immune system is not really an organ system, but it's a functional system. Innate and adaptive defenses are intertwined. They both release and recognize many of the same defense molecules. There's an innate defense to do specific pathways for certain substances. There's also an innate response release proteins that alert cells of adaptive system to foreign molecules. So here's our two different systems, our innate defenses and our adaptive defenses. There's our innate, our skin surface, our internal ones. So our innate defenses are phagocytes, natural killer cells, inflammation, antimicrobial proteins. Fever is an innate. Then our adaptive defenses, that's our humoral immunity. Those are the B cells and the T cells. And remember, those B cells and those T cells, that plays an important function in the lymphatic system. So our innate defenses. Innate system uses the first and or second lines of defense to stop attacks by pathogens. So our skin, our surface membranes, our mucous membranes, these are a physical barrier to most microorganisms. Keratin is resistant to weak acids and bases, bacterial enzymes, and toxins. Remember, our nails are made up of keratin. Mucosa provide similar mechanical barriers. So skin and mucous membranes produce protective chemicals such as acid and enzymes. The acidity of the skin and some mucosal secretions inhibits growth. That's called acid mantle. Enzymes, lysozyme of saliva, respiratory mucus, and lacrimal fluid kills many microorganisms. Enzymes in stomach kills many microorganisms. So we also have mucin, defensins, and other chemicals. Mucin, sticky mucus that lines digestive and respiratory tracts. Essentially that traps microorganisms. Defenses, antimicrobial peptides that inhibit microbial growth. And then other chemicals, lipids and sebum, which is that oil secreted, and durcitabin in sweat are toxic to some bacteria. Our respiratory system also has modifications to stop pathogens. So our nose, the cilia on the nose, the mucus-coated hairs in the nose trap inhaled particles. And the cilia of upper respiratory tract sweep dust and bacteria-laden mucus towards the mouth. All right, so here's our first line of defense. So now let's go to our second line. That's innate system necessary and microorganisms invade deeper tissues. So say we have a cut, so that first line of defense has been broken. Now we're going to the second line. These are our phagocytes, our natural killer cells, inflammatory responses, macrophages, mast cells, white blood cells, and inflammatory chemicals. Antimicrobial proteins, interferons, and complement proteins, and fever. Remember, fever, if our temperature rises high enough, we're going to kill off things naturally. Many second line cells have pattern recognition receptors that recognize and bind tightly to structures on microbes, disarming them before they ever do harm. One class is toll-like receptors that play a central role in triggering immune systems responses. Humans have 11 different triggers, those toll-like receptors. Each recognizes a particular class of attaching microbe. Phagocytes. These are white blood cells that ingest and eat foreign invaders. Neutrophils, those are the most abundant phagocyte, but die fighting, becoming phagocytic on exposure to infectious materials. So phagocytes, essentially, they are hungry. So if you think of fat, the PHAT, like the cool, they're hungry and they want to eat. And then neutrophils are like ninjas. They are going out and they want to die fighting. Macrophages develop from monocytes and are chief phagocytic cells. Most robust phagocytic cell Free macrophages wander through tissue spaces. An example is an alveolar macrophage. Fixed macrophages, permanent residents of some organs. Example, the stellate macrophages of the liver and microlegia in the brain. All right, so phagocytosis. That's a process that starts when the phagocyte recognizes and adheres to the pathogen carbohydrate signature. Some microorganisms have external capsules that hide their surface carbohydrates, helping them evade phagocytes. So they're kind of in hiding. Opsonation, that's our immune system uses of antibodies to complement proteins as ospicins that coat pathogens. These act as handles for phagocytes to grab onto. Phagocytosis. So this just kind of goes and describes how phagocytosis occurs. Excuse me. Okay, so phagocytes, I think that's pretty much it with those. We're going to move on to natural killer cells. Non-phagocytic large granule lymphocytes that police blood and lymph can kill cells and virus-infected cells before an adapted immune system is activated. So they can kill cancer and virus-infected cells before the immune system is activated. They attack cells that lack cell surface receptors. Say that 5 times fast. They kill by inducing apoptosis in cancer cells and virus-infected cells. So inflammation is triggered whenever body tissues are injured. Injuries can be due to trauma, heat, irritating chemicals, or infections by microorganisms. These benefits of inflammation prevent spread of damaging agents, disposes of cell debris and pathogens, alerts adaptive immune system, sets the stage for repair. So what are 4 cardinal signs of acute inflammation? This is always going to be the same. You're going to see this time and time again with patients. We're going to have redness at the site. It's going to be hot. There's going to be some swelling, and it's probably going to be painful. They might not have all of these at one time, but you'll see that. And there's also sometimes a 5th sign, which is impairment of function. Essentially, they're not able to move the area like they used to. So there's stages of inflammation. So inflammatory chemical release is the first, vasodilation and increased vascular permeability, and then phagocyte mobilization. So with the inflammatory chemical release, for example, histamine is released by mast cells, and that's a key inflammatory chemical. We also have other mediators besides histamines, and it kind of goes on to tell you about those as well. There's our inflammatory chemicals. Vasodilation. Essentially, vasodilation is our vessels are going to dilate. This causes hyperemia, which is congestion with blood, which leads to redness and heat. Increased capillary permeability causes extudite, fluid containing clotting factors antibodies to leak into the tissue. This results in local swelling or edema. Swelling also pushes on nerve endings, resulting in pain. Pain can also result from release of toxins from bacteria. Benefits of edema, though, it's a surge of fluid in the tissue, sweeps foreign material into lymphatic vessels for processing in lymph nodes. This delivers clotting proteins and complement to area. And that just goes on to talk about the steps of tissue response to injury. So something that can go wrong with the immune system, pus. I mean, most of us have had some kind of something that has led to it being pussy. So what is pus? It's a creamy yellow mixture of dead neutrophils, tissue cells, and living dead pathogens. An abscess, collagen fibers are laid down, welling off, sac of pus, may need to be surgically drained. We see this a lot with like the pimple popper shows, where somebody has had an abscess and then the pus gathers there, and she goes in and she pokes it and clears out all the pus. Some bacteria, such as tuberculosis bacilli, resist digestion by macrophages and remain alive inside. Can form tumor-like growths called granulomas, areas of infected macrophages surrounded by unaffected macrophages and other capsules. Antimicrobial proteins enhance innate defense by attacking microorganisms directly or hindering microbes' ability to reproduce. Antimicrobials, like our hand sanitizer. Interferons, it's an antimicrobial protein. Going on with the antimicrobial proteins, we have complement. Complement system consists of about 20 blood proteins that circulate in the blood in an inactive form. These provide major mechanisms for destroying foreign substances. Classical pathway. There's 3 different pathways. The first one's the classical pathway. Antibodies first bind to invading organisms and then bind to complement components, activating them. Double binding called complement fixation. Then we have the lectin pathway. Lectins are produced by innate system to recognize foreign invaders. When lectin is bound to specific sugars on foreign invaders, it can also bind and activate complement. And then the third pathway is the alternative pathway. Complement cascade is activated spontaneously with certain complement factors bind directly to foreign invaders. Fever. So remember how I said abnormally high body temperature is that a systematic response to invading microorganisms. When someone develops a fever, usually it's the first sign of infection. Leukocytes and macrophages exposed to foreign substances secrete pyrogens. Pyrogens act on body's thermostat and hypothalamus, raising the body temperature. Benefits of moderate fever: causes liver and spleen to sequester iron and zinc, and increase metabolic rate, which increases rate. All right, so there is our chapter 20 of our immune system.